What's happening in China? Massive outbreak in Guangdong province, especially in Foshan City, with over 7,000 confirmed cases since mid-June 2025. Some outlets report up to 8,000 infections within just 4 weeks in the region. These figures mark one of China's largest chikungunya outbreaks since the disease was first detected there nearly 20 years ago. What is chikungunya? And why is it concerning? Chikungunya is a mosquito-borne viral disease, transmitted by Aedes aegypti and Aedes albopictus. It causes sudden fever, severe joint pain, muscle aches, rash, headache, and fatigue, typically developing 3 to 7 days after a bite. Symptoms usually resolve within a week, but joint pain can persist for months or even years in some cases. The risk of death is very low, about 1 in 1,000. But vulnerable populations like the elderly, young infants, and those with chronic conditions face higher risks. China's public health response. Authorities have implemented aggressive containment measures, echoing COVID-era tactics. Isolation of infected individuals in hospital wards under mosquito nets, with mandatory 7-day stays or until negative tests. Intensified mosquito control campaigns. Spraying insecticides, public sanitation drives, and removal of stagnant water. Non-compliance may lead to heavy fines or utility cutoffs. Use of biological vector controls. Elephant mosquitoes, Toxorynchites splendens, that prey on Aedes larvae and mosquito-eating fish have been introduced in hotspots like Guangdong. Surveillance technologies deployed. For instance, drones are being used to detect breeding grounds. San Francisco Chronicle. The peak monsoon season has worsened the situation by flooding breeding grounds, making water-based transmission far more likely. Reuters. Global context and travel guidance. The outbreak prompted the US CDC to issue a Level 2 travel advisory, practice enhanced precautions, for travelers to Guangdong province, especially Foshan. Globally, more than 240,000 chikungunya cases and around 90 deaths have been reported in 2025 across several countries including Bolivia, Kenya, and Sri Lanka. San Francisco Chronicle. Vaccine and prevention measures. 2 chikungunya vaccines are approved in the U.S., live attenuated, Ixchiq, and virus-like particle, Vimkunya. However, use of the live attenuated vaccine, Ixchiq, has been paused for individuals aged 60+ in the US, EU, and UK due to safety concerns including neurological and cardiac events under investigation. Key takeaways and practical advice. This is a serious vector-borne disease outbreak, but it is not transmitted person to person, and is rarely fatal. Control efforts are focused on reducing mosquito populations and protecting individuals from bites, in much the same way dengue or Zika outbreaks are managed. If you're traveling to or residing in affected regions, use mosquito repellent, wear long-sleeved clothing, stay in air-conditioned or screened accommodations, and eliminate stagnant water around your environment. Vaccination may be recommended, but consult a health provider especially if you are over 60 or have underlying health issues. Watch for symptoms, fever, severe joint pain, rash, and seek medical advice if they appear. Warning: comparison to COVID-19. While government response measures may resemble early COVID-19 protocols, hospital isolation, quarantines, public mobilization, it's important to note. Chikungunya is not a respiratory virus. It does not spread from person to person, only through mosquito vectors. Mortality is much lower, typically under 0.1%.